A mental illness is defined as a health problem that affects the way a person feels, thinks, behaves, and interacts with other people. The most common types of mental illnesses include clinical depression and anxiety disorders, conditions that cause a persistently depressed mood and constant feelings of worry and fear. The symptoms caused by depression and anxiety are just some of a large list of disorders and illnesses, ranging from schizophrenia, an illness that distorts reality and increases abnormal social behavior, to dyslexia, an illness that affects the ability to read and spell. Depression is an emotion-based illness, shrouding the victim with depressive feelings throughout their daily activities. Although the illness mainly affects emotion, it can have an impact on physical conditions, behavior, and thoughts too. This involves the inability to concentrate, being tired all the time, a loss or change of appetite, and the withdrawal from friends and family. Although the specific cause for depression is still unknown, there are many factors that can be linked to the development of depression, things such as life events or personal issues. Just like how we have our modern theories, the people from the past also had a few ideas about the cause of depression, resulting in different treatments. Schizophrenia is a mental illness that disrupts the functioning of the human mind, causing intense periods of psychosis and a lack of emotion are just two of the many symptoms the illness can cause, others including hallucinations, delusions, disordered thinking, and disordered behavior. Although there is treatment for schizophrenia, such as therapy or antipsychotic medication, the illness does not have a cure yet, meaning that it can either last a few years or an entire lifetime.
In the Dark Ages, from 13,000 AD to 1500 AD, our main theory of mental health was strongly connected to our theory of physical health. Our main theory revolves around the four humours:
water, earth, fire, and air.
Each humour has a fluid linked to it, all of which was a part of the blood. Fire was represented by the yellow bile, which was a clear yellow serum. It contributed to being hot and dry. Earth was represented by black bile, which was a dark clot at the bottom. It contributed to being dry and cold. Water was represented by phlegm, which was a layer of white blood cells. It contributed to being wet and cold. Finally, air was represented by blood, which was the red blood cells. It contributed to being hot and wet. An imbalance of these four humours leads to being sick, either mentally or physically. It was believed that a high level of black bile led to being anxious or depressed. Some treatments to fix this was eating air foods, as they were the opposite of earth. Other treatments were a bit more extreme, such as the cupping therapy, which was heating up cups and placing them on a patient's back, which would, due to the heat, suck up their skin, which in theory would remove the excess bile. Another method was bloodletting, which was cutting open a wound and letting some blood out. It was also believed that an excess of yellow bile led to aggression, which could have been treated by eating water foods, as well as also using the cupping theory. An excess of phlegm, however, led to people being apathetic and lacking emotion. As a result, fire foods were the treatment. The four humours contributed to more than just medical and psychological theories, though. It was believed that each person had a certain affinity with each element, with the elements also being ranked against each other, with air being the highest and earth being the lowest. As a result, food that was air-related, such as food that is grown high in the sky or lives in the sky, was safe for the rich and noble, whereas peasants were stuck with the food that grew in the ground.
The treatment for the mentally ill in the period of social change revolved around psychiatric hospitals, or better known as asylums. Asylums are the most common treatment or places to get treatment in the 19th century, rising in popularity in the 1840s. The aim of asylum usage was to change the way society treated and viewed mentally ill people, emphasizing rehabilitation. Before the asylums were put in place, the mentally ill were thought to be a result of sin or demonic possession, which is why ideas such as trepanation were used back in the day, drilling holes in people's heads to allow the demons to escape. The similarities between the modern hospital and the 19th century asylum are conspicuous, both treating patients through therapy, medication, and the support from the community. However, asylums in the 19th century weren't always pleasant environments for the patients. Some of the treatments used in the early 1900s were more torture devices than treatment for the victims, This included being chained up, left in a filthy dungeon, or branded by red-hot iron to bring them to their senses. Luckily for the mentally ill, this all changed when Dorothea Dix came around. Noted as a humanitarian and an educator, when she visited the Cambridge House of Corrections in March 1841, she witnessed the abuse of the patients, enraging her. Taking the matter to court, after winning the case, she decided to begin her crusade to change the asylums and to reform them. Because of her actions, Dix is now labelled as a nursing pioneer, helping shape asylums into the hospitals that are still being used in the present day.
In the modern day, we still don't know the exact causes of depression. However, we have a few theories. Depression is a complex condition and as a result have complex causes. It is believed that there are multiple causes, and a combination of such causes will lead to depression. These are genetic reasons, and that some people are genetically more prone to depression, biological reasons, where there are some changes in neurotransmitter levels, generally serotonin, environmental reasons, or psychosocial reasons. Some of the environmental reasons are certain life events, such as a distressing event, such as a divorce, breakup, or a death. Childhood trauma, certain drugs, both prescribed and otherwise, head injuries, past depression episodes, or chronic pain syndrome. Now, we have two major forms of treatment. They are therapy or drugs. Generally, a mentally ill person will visit a psychologist. The most common therapy is known as cognitive behavioral therapy, or CBT to be short. This follows a few steps to attempt to help the mentally ill person get better. The first step is to understand what the issues are. Afterwards, the therapist aims to help the patient gather their thoughts, emotions, and beliefs about the issue, or the issues. The therapist then tries to persuade or show why certain thoughts, emotions, and beliefs are problematic or negative. Afterwards, the patient and therapist discuss these issues in depth. The therapist could also ask what behaviors these thoughts cause and suggest healthier or less harmful ways to overcome the issues the patients are having. In severe cases of depression, there are also antidepressants. They are drugs which help to prevent depression. There are 5 different forms of antidepressants: SNRIs, SSRIs, TCAs, MAOIs, and NASSAs. SNRIs, or serotonin and noradrenaline reuptake inhibitors, along with SSRIs, or selective serotonin reuptake inhibitors, are the two most common forms of antidepressants, with the latter being slightly more common. SNRIs, as the name suggests, works by raising the levels of serotonin and norepinephrine, two mood-controlling neurotransmitters. SSRIs work by blocking the reabsorption of the serotonin into the axon, which allows more of it to go towards the dendrite, resulting in higher levels of serotonin. These drugs are more common than SNRIs as they have less side effects. MAOIs, or monoamine oxidase inhibitors, used to be more popular before SNRIs and SSRIs were created. Now, however, they are prescribed if SSRIs do not work. They work by reducing the effect of the monoamine oxidase enzyme, which is the enzyme responsible for breaking down neurotransmitters such as serotonin. As a result, there are more of these neurotransmitters. The two other types, NASSAs, or noradrenaline and specific serotoninergic antidepressants, or TCAs, or tricyclic antidepressants, are not as popular as the others. A study conducted by the Cochrane Library showed that the TCAs worked more than placebos, showing that the TCAs actually work rather than it just being a placebo effect.